So for my global health clinical hours, I traveled to Kenya and I worked at a public health clinic in a village near Mombasa for 2 weeks. The placement is called Shimalatewa Annex, and it's a public health clinic operated by the Kenyan Ministry of Public Health and Sanitation. It's also next to a prison, and it provides free healthcare services to the local population as well as to prisoners in the prison that's attached. It was a very basic structure, approximately 6 to 8 offices, two outdoor waiting areas, and then there's a metal shipping container that they've turned into a TB clinic and an HIV clinic. The HIV clinic offers a clinic once a week to adults and once a week to children. And there's also a small maternity area. They offer a lot of different services there. There's a walk-in clinic, a lab, a child immunization and growth monitoring clinic, a family planning clinic, a prenatal clinic, a small pharmacy, and then the HIV and TB clinics that I mentioned and the maternity area. So I was able to spend some time working in each area, but I spent most of my time working in the maternity and immunization growth monitoring clinics because I found them to be the most interesting. A nurse travels to the prison every morning to do prison rounds on newly admitted inmates as well as sick inmates, and so I got to attend that on 2 occasions, which was really interesting. So there's no there's no doctors at all in the whole clinic. It's all entirely run by nurses, and then prison guards do a little bit of administrative work. So the nurses do everything. So assessing patients, diagnosing conditions, prescribing medications, delivering babies, and anything else that's necessary. So there's about 6 to 8 nurses on at any given time, and about 50 to 75 people are served per day. Again, it's extremely basic conditions, extremely hot, like over 40 degrees, no air conditioning, and just a real lack of basic medical supplies. So the project that's been assigned to me is to journal about my experiences. So I'll do a literature review to focus on a country overview of Kenya and talk about a health-focused demographic profile of the region and a description of the area and population I was working with. I'll give some information about healthcare services in Kenya that are provided by the government. I'll describe the clinic in depth, describe my interactions with patients and staff and some of the meaningful experiences that I had. And then I'll have some appendices, which will include photographs and other findings presented from my research. Thanks.